I'd like to now introduce Sarah Fereday, who's the professional leader of physiotherapy, and Santina Lopreiato, got it right, an allied health assistant working in physio. They're both from the Royal Rehab Centre in Sydney, and we've invited them here this afternoon to showcase how some of the aspects of the framework actually work in practice. Now, in the online program, I said there were snapshots of that. Now we have our real life example of exactly that. So I'll just hand over to Sarah and Santina. Thanks so much for coming.
Thank you, Sue. I'm one of a team of 3 full-time physios. I'm the part-timer there who work with Santina and in fact another assistant in a 30-bed general rehab unit. I've been working with assistants for a very long time, and over the past few years I've seen the role of the physiotherapy assistant in rehabilitation change. Traditionally, we've used assistants to help with what we've called doubles, and all physios in the audience will know what that means. It's when you need 2 pairs of hands to help someone transfer, help someone stand up and help someone walk. And the assistant was the helper, well, and still is. The assistants would clean and tidy gyms, as they still do, and they'd have admin duties and they'd help in areas like the hydrotherapy pool. Essentially, there was no formal timetabling. The assistant was in the gym for most of the day and essentially sort of at the beck and call of the physiotherapist. So, you know, the physios would say, "Can you come over here and help me? Can you help me, please?" Probably still do to a certain extent. Delegating extra practice sessions for patients was done on a rather ad hoc basis. It might be that the physios might ask the assistant when they were going to a case conference, for instance, "Oh, have you got time this afternoon? Could you please help Mr. Jones with a second walk?" There was little structure to the day for assistants. Well, this has all changed, as you will hear. Santina, can you describe a typical working day for you? Maybe think of what you've done over the past few days.
Sure, Sarah. So my day starts with... So my day starts with walking patients to breakfast. These are patients that are allocated to me by the therapist, and they're generally patients that require assistance or supervision with their mobility. After the brekkie walks, I spend some time doing admin tasks, so that's checking our phone messages, our internal mail, updating our nursing handover sheet, also our daily inpatient list. Then I'll spend some time cleaning the gym and tidying it up, getting ready for therapy sessions, ensuring there's plenty of linen and water for the patients. Then we'll have a brief meeting with the physios just to discuss the plan for the day, especially if we're short-staffed that day, which happens often. Then after that, I would start to bring patients down to the gym for their therapy. So I'm allocated a timetable with a list of patients to work with, and these are patients that are generally requiring supervision or set up with their exercise program. Then I'll also help the therapist, as Sarah's mentioned, with the double assistant patients. So that's to either assist with hoisting or sitting balance exercises or perhaps mobility practice. Then it's probably lunchtime. When we get back from lunch, I'll see patients for a second session, and that's generally a fitness-based session. So it's either practice on the treadmill or bike or motor med or sit-to-stand practices. After that, we would run a circuit class. So that's a group class aimed for our higher-level patients. And it's a class that contains 10 different stations with 10 different exercises, and the patients rotate between the 10 stations. Each station goes for about 3 minutes, and at the end of the class they'll participate in a 6-minute walk challenge, and that's when they walk 10-metre laps up and down the gym, and they count the amount of laps that they do, and then it gets recorded onto a whiteboard, and there's a champion patient for the week. So the patients either love it or hate it. It's quite an intense class. Then I'll end the day with entering notes into the medical files. I'll do another little general tidy up, enter my stats for the day, and also leave a handover for the therapist if there's any adverse events that may have happened in the afternoon. And I'd do that either through verbal communication or in our communication book. And that's a typical day.
I think I've just been put out of a job. Santina, what would you do if one of the patients you were working with and following an exercise program that the physios had prescribed, if they found that if they couldn't manage that exercise, or if one of the patients became acutely unwell during a session?
Sure. If there was a list of other exercises that we could practice from the program, we'd progress onto those if it was safe to do so. But if the patient really didn't look very well and they were declining to continue with practice, I'd end the session and return them back to the ward. I'd advise the nurses and let them know to perhaps maybe just do some observation checks and just let the patient rest. And I'd also enter a note into the medical files and leave a handover for the treating therapist for that patient as well.
Okay, you work with 3 physios, and I know that can be challenging. They're all asking you to help them with the patient at the same time, or do some extra therapy with someone whilst they're all at a case conference in the afternoon. Can you tell us how they delegate work, or we delegate work to you, and essentially ensure that you're not being asked to do too much?
Yeah. Well, sometimes I wish I was an octopus. It'd be handy if I had the extra arms, but I am allocated a weekly timetable with a list of patients to work with, so either independently or with a therapist. I'm also handed tasks to me through the morning meetings that we'll have. Definitely tasks are delegated to me throughout the day just to do odd things here and there, and we have a communication book as well for tasks that are outside of my general duties. And the friendship between my supervisor and myself is very open and friendly, so if I do feel overwhelmed with tasks, I can let him know and feed that back to him, and he would reassess and prioritise the tasks accordingly. Yeah.
What sort of training have you had, and what opportunities do you have for ongoing professional development?
Yeah, so I completed my Cert 4 certificate at the Royal Rehab College. The theory part of that was done through correspondence, but the course did have a lot of practical workshop components, and I had lots of on-the-job training at Royal Rehab. As part of my position, I have the opportunity to attend in-services and journal clubs, and when we get students on work placement, I have the opportunity to attend the student tutorials as well, and I'm able to ask physios questions throughout the day, so every day I'm learning something new. Yep.
And what sort of support and supervision do you have?
Well, we're a very close-knit team. It's like a little family. Our relationship's very friendly and professional. So I have day-to-day support from all physios and throughout the day. For more formal supervision, I meet with my supervisor about every 2 months. When I first started the role, we would meet more frequently, but as my skills and experience developed, we would meet just once every 2 months or so. In the meetings, we just discuss any issues that I may have. We would discuss
maybe parts of your professional
development plan goals. What I'm doing well, what I might need to improve, and perhaps any annual leave or any operational issues. And also the minutes of the meeting are they're written out on a standardised supervision for referral and filing. Yep.
And obviously all those day-to-day patient issues, if you have any questions, you can just ask them and check as you're going along.
That's right, yeah.
Good. So as we've just heard from Santina, as assistants become more experienced, the need for direct supervision and the frequency of one-to-one meeting reduces. We know that assistants with a Certificate 4 do only require indirect supervision. However, having said that, it's the rapport that you build with the assistant that is so important. It really comes down to a good working relationship and trust and respect. We know that our assistants are very capable, and as Santina said, she's learnt so much over the past 2 years working with us. We'll often delegate a caseload to our assistants if a physio's on an ADO or sick leave. And we can do that because we work in a rehab environment. We work so closely together in an open therapy area. And we do know and trust that our assistants know their boundaries, and we do know that they will come and ask questions if they have any concerns. And at Raw Rehab, all the allied health professionals who work with assistants, I mean, at the moment it's physio, OT and the recreational therapists, we really value their role, and they are an integral part of our team. They come to all our staff meetings, all our in-services, etc. And I personally look forward to the day when allied health assistants have a more opportunity for a career structure, and maybe we can go down, the line of what they're doing in the UK and possibly some other states. And just to finish, I thought it might be interesting to hear from Santina about what you like most about your job and why.
Oh, there's plenty, but it's amazing to see when a patient arrives to the hospital on their admin and they're unable to walk or talk or use their arm, and they leave on discharge walking out with a stick and waving as they say goodbye. It's a great feeling. I love how my job's challenging on lots of levels, physically and mentally and definitely emotionally. But I have to say the best part of my job's probably being able to build rapport with the patients, whether it be within 2 weeks or 2 months, particularly with the patients that are unable to communicate, so either because of aphasia or they can't speak English, and your whole session's based on demonstration and body language and facial expressions. And the fact that you can break that barrier and still be able to treat someone and improve their lives it's priceless. Yeah.
Thank you.